Jessica. Looks like the doctor has ordered for us to change your dressing. Along with that, we'll get a blood sample and change the cap on your IV or your central line as well. So can you go ahead and verify your name and date of birth, please? Okay, so we're going to go ahead and change your cap with every dressing change, which will be every 7 days. Unless it gets dirty or contaminated, then we'll change it again as needed. This is a sterile procedure, so I'm going to ask you to wear a mask while we're doing it. And if you need to cough, please turn your head to the side to your left, just so that we reduce your chance of infection. Do you have any questions? No? Okay. Well, I'm going to go ahead and get my supplies ready. And I will be putting on a gown and gloves. So, and a mask as well. And a pair of gloves. Okay. Okey-doke. So the first thing we're going to do is take off your old dressing. I'm going to use an alcohol wipe just to kind of loosen up the edges so it's a little bit easier to take it off. Okay, now I'm going to start at the outside, peeling off the dressing. Okay, and I'm going to take care to pull it towards the IV, towards the line starting from the outside. I'll also be looking for any signs of infection, including inflammation, drainage, reddened areas. And be real careful not to tug at the line. Okay, go ahead and take this off. Go with my finger. All right, let me go ahead and wash my hands, and I'm going to set up my sterile field now. So this is where we need to be very careful to reduce infection and keep your head turned for me. Open. I'll break open my chloropleth. Now I'm going to wash really well back and forth with vigorous motions all the way around, making sure I get under the skin, up and around this line. Okay. No, that's all right. If there's any extra blood, I'll go ahead and just use an alcohol wipe to help get that off, but we're good for now. I'll go ahead and grab this. Okay. So once I've got that on, take this off. Comes with a sticker. I'll go ahead and use this sticker here and make sure I time it I'll date it and put my initials on it when I change the dressing. Okay, went ahead and do that. Okay, let me go ahead and I can clean up my mess and take off my sterile gloves. Okay. Okay. Now I'm going to prepare my supplies. Alright, so I have a couple of saline flushes. One I have pre-flushed with a cap on it, 5 cc's of heparin, 2 empty 10 cc syringes, tape, a needle, and a Vacutainer. So I'm going to go ahead and take off the old tape. Discard that. Alright, so I'm going to clean the cap very well for 15 seconds. Okay. First thing I'll do is flush with 10 cc's of normal saline. I'm going to unclamp, and using the push pause, we'll go ahead and inject the whole 10 cc's. I'm going to clamp, remove. I'm going to get an empty 10 cc syringe. Unclamp. I'm going to remove 5 cc's. Clamp. Now I will go ahead and discard this. I'll grab another empty 10 cc syringe. Unclamp. Clamp. I'm going to hook this up to a needle. We'll inject this into the Vacutainer. On the Vacutainer, I'm going to put the patient's name, date of birth, my initials, and the date and time of collection, and I will send this to the lab. The last thing I'm going to do is change the cap on the central line. So I do have a pre-flushed cap ready. I'll remove the old cap, my pre-flushed cap. I'll unclamp, and using push pause, alright, gonna clamp it, remove, and I have 5 cc's of heparin. I will flush it with. Unclamp, and push pause. And clamp. Okay, so the last thing I'll do here is I'm going to secure the line. And I have tape. Mr. Jones, we're all done today. Do you have any questions? I'll go ahead and clean up my area and make sure these go in the Sharpie container. All right. Alrighty. Let me wash my hands. All right. I'm gonna go ahead and chart. Can I get you anything else?